Hi, everybody. Golden Era Bookworm here. I have Dr. Cheeky Strauss. I know it's a cheeky name.
It's a
Uh,
very cheeky name, but we are trying to be like two gentlemen today, just as always.
Expert endocrinologist, TRT doctor in Switzerland, and we're going to have a very honest and open conversation regarding testosterone replacement therapy, regarding older protocols, newer protocols that are available nowadays, the side effects regarding TRT, the benefits, of course, and we're actually going to do an analysis of my own personal levels and what uh, the doctor's opinion is about whether I should take testosterone or not. So I really want to thank you, doctor, for your time this evening.
It's my
Uh,
pleasure.
yeah, and let's get started straight away. Okay.
Yeah, so usually how do we tend to start our consultations with our patients? How did you come up with this idea, concept of testosterone? Of course, you are in the bodybuilding industry. How was your first confrontation? And yeah, how have you felt lately?
Well, firstly, I mean, as you mentioned, being in the bodybuilding industry, being aware of uh, what bodybuilders have been doing for the last, 70 years, taking steroids to enhance their physique, you know, that wasn't necessarily my motivation, you know. I've always been a natural lifter. But besides that, I'm a medical scientist, and that's where my attention towards my own health came from, working in a clinic for the last 5 years, I often had to do pre-diagnostics on hormonal um, queries from doctors,
Mhm.
and it made me question my own because throughout the last 5 to 10 years, I've realized certain things are changing. I'm 46 this year, turning 47 in 4 months, and I've noticed that, for example, I'm more exhausted. Of course, with my age, I don't recover as well as I used to. I train and I often have a lot of pain in my joints, something I haven't mentioned yet. Um, 2 years ago, I was in a wheelchair, right?
Oh.
And I that's when I actually really started focusing even more so on whether I needed to optimize my testosterone or not. Because I know that testosterone has many benefits, including decreasing, if I'm not mistaken, pain in the body, right? At least that's been reported.
Yeah, it might have an effect on pain levels and reducing pain levels, but we also have to emphasize, I mean, it's not a wonder drug. I mean,
Exactly.
it's even if it's produced naturally, it should be produced naturally in a high enough level in every man, but it's I mean, it's not a wonder drug where which we can just prescribe and okay, your pain is gonna go away.
Yeah.
Well,
No, again, it's good that you address all these things. Um, but yeah, I noticed tired, pain, not sleeping well. I was, under a lot of stress, of course, in this job. But just these changes in me as I now approach a more mature age, falling over more often than I ever used to. I was never clumsy, but now
mhm.
a couple of months ago, I snapped my ankle. This is the second time it's happened, in the last couple of years. And this time, the recovery is way longer than it used to be, right? Um, my focus, I find that I'm less focused, and the worst thing is that sometimes I'm trying to explain something and I say the wrong words. And then I
Mhm.
realize what I said, and I'm like, I'm so sorry I said the wrong word. So there's a lot of things going on there. And I started checking all these things out, and the one thing I've done a test, I believe, online, right? I forgot the name of it. And I put all these,
Adam's test.
yeah, the Adams
There
test.
there is, yeah, the Adam's test, yeah.
And it said, yeah, you definitely should speak to a doctor about testosterone replacement therapy because your testosterone might be low. So I went to see my doctor, got my results back, and they're not optimal. you know.
Mm.
And that's when I started talking to a lot of my friends who are my age. And I saw specifically one friend in summer who a year or two ago, he was a disaster. He was overweight. His skin, he had autoimmune issues. He was overweight and he was telling me, Carlos, what can I do? And he went to see his doctor and his doctor realized he had very low testosterone levels, gave him TRT, and I saw him in summer and he's just a different person, right?
Good
He's
for him.
best decision he ever made. Um, so energetic, working out now, and just feels like a new man again, right? And he's not the only case. I've spoken to many of my friends, and they all told me the same thing. And so that was really, to me, the motivation to look into my own health because I'm worried. The older I get, I assume the worse my testosterone levels are going to get, and the more these symptoms that I'm having are going to not just get worse but increase, right? So that's what prompted me to search for your help. So
Yeah, sure. So just one quick recap, all your friends, I mean, who have undergone TRT lately, they are undergoing TRT and not, testosterone abuse, right? That's
correct.
great. So they're, yeah, so, okay, it's under the supervision of a doctor,
Yes.
physician. All
Yes.
right, all right. Good. So symptoms. Let's talk about the symptoms first. Well, testosterone deficiency, or even just so to say, low normal testosterone levels, they can cause many symptoms. I tend to call it the three-pillar system, just like the pension system in Switzerland. First, second, third. First pillar, that's just general well-being. Okay, how you feel. You mentioned, okay, your energy levels, they decreased, they have decreased lately. Then the second pillar, that's sports and recovery, how well you recover after certain injuries and how much you can perform at the gym or whatever your sport you are opting for. And the third one, that's a sexual field, libido, erection quality. So these are the three pillars. Okay. And we're also going to talk about this decision matrix, how we as physicians and TRT specialists, how we tend to evaluate, okay, is a man a candidate for TRT or not? We tend to look at these three pillars. Okay, do they have low testosterone levels? And also, these low testosterone levels, are they matched with the obvious clinical symptoms?
Yeah, I think that's really important because as as I said, I've been looking into my own hormonal health for the last now 10 years. I don't know if I mentioned that, but and I realized that my levels at some points were suboptimal, at other points were borderline horrific, right? And we'll get to that a little later. So
Yeah.
but it's nowhere near optimal. Let's put it that way.
Mhm.
And it's hovered around this area. And, that really scared me. I went to my doctor and she said, this endocrinologist, a local one, said, yes, we do TRT. We need to take 2 or 3 measurements over several months. And this first one, I remember was 11, which is horrific. It's borderline. She says, that's not enough. And I was like, what? That's terrible. And she's like, no, you need to take a second one. The second one was like 13 or 12.9 or something like that. And she's like, no, you're fine. You're within the range. I'm like, you gotta be kidding me, right? And I told her, just like I told you, you've got all these symptoms. And she goes, look, what I can offer you is a bolus injection, right? One injection every 2 months or so of 2,000 milligrams. And I was like, well, what the hell are you gonna do to me, Because I understand, of course, being a medical scientist, that diurnal fluctuation of testosterone, it never remains at a high level. For a few hours it spikes and then it goes down. And of course, you know this, but the audience may not, right? And so I understand that a bolus injection is not too different to a testosterone cycle that a steroid, uh, you know, I wouldn't say a professional bodybuilder would do, but someone who's probably doing his first cycle would want to do, right? That's the kind of levels that they're doing, right?
Yeah, give or take. Yeah, give or take. So what bodybuilders tend to administer, I mean, that's not my area of specialty, but they're the agents they tend to get absorbed by the body way faster. And what this doctor wanted to prescribe you, that's the testosterone
Yeah.
Undecanoate in German, um, or with the brand name, it's Nebido. Well, for patients who have clinically low testosterone levels, they are over the age of 70, 80, and they just want to have some kind of solution, set it or forget it regimen. They tend to be fine with that, even if they get these super physiological levels. And at the end of the cycle, before getting the next injection, 4, 6, 8 weeks after the first one, they tend to get really low suboptimal levels.
Yeah, and I mean that's what worried me. Um, you know, you just said it like having such a high dose injection would get me to a super physiological level. And sure, if I was a bodybuilder, I'd love that. Um, but w what people don't understand is that the half-life, although it's quite long, by the end of the second month, I'd be depressed and I'd have a crash in energy and everything, insomnia, because at that point, my testosterone production would have shut down and
Absolutely. Yeah.
it would be sub-physiological. And so, of course, with that, I'm absolutely sure that there are side effects. Can you explain the side effects of such an aggressive TRT methodology that was done, a good 10, 20 years ago and actually still is done today? Could you elaborate on
Yeah,
that?
it's still the most frequently prescribed TRT regimen, especially for elderly people. Yeah, well, the side effects we tend to see a so-called polycythemia when the red blood cells increase in the amount, and that could have pretty serious consequences. Well, I mean, you can imagine if your blood gets thicker, then what might happen? Thrombosis, right? And that's what we are striving for, not to aim for something like that, right?
Hypertension as well, of course. So,
Hypertension as well. Yes,
uh,
it might have negative effects on the prostate gland. However, that's not really clinically proven as, I mean, just by the testosterone, if is it really gonna cause a prostate enlargement? But I mean, the main side effect that we really try to avoid is a polycythemia. So when the red blood cells increase
yeah.
in the
And
count. Okay.
and people may not understand the ramifications of that. Of course, the kidney is our blood filtration system, and having polycythemia can actually damage the very fine filters of the kidney, and therefore have an issue with causing kidney
Mm.
disease. Is that correct?
Yeah, well, the kidneys, they are some very tough organs. I mean, I mean, it's gonna definitely have some kind of negative effect.
Mm.
I mean, I would no, I would rather say it's not gonna have a positive effect on the kidneys, especially if someone develops hypertension as well. In what extent it might have a negative effect?
Exactly. It's hard to say.
Great question. It's hard to say. We don't know. We don't know.
And of
The
course,
main point is that that's a therapy that we are really striving for not to recommend, because we
yeah,
know that there are much better. So I always I always tend to if the I mean provide an example to our patients. Look, I mean no offense, you can buy, I mean you have plenty of options for the same amount of money. You can have and again no offense, a Volkswagen or a Porsche.
yeah,
Which one do you want? And it costs the same amount. Also, maintenance, something, even the maintenance is even lower for the Porsche in this case than for the Volkswagen.
absolutely. I mean, you mentioned the side effects of prostate, and there's a negative connotation regarding testosterone and prostate cancer. But as you said, it's never truly been proven.
It has been debunked. No, it has never. So for, I mean, we as physicians, we should not recommend TRT even for those patients who are clinically low in testosterone, who have an active prostate cancer.
Yes. I'm aware of that.
Yeah, but that's the only I mean, that's the only, I mean, exclusion
Yeah. The
for TRT.
exception.
Yeah.
I find one thing very interesting that I read the other day, um, and that is that, funnily enough, and coincidentally enough, it's during the age of men where testosterone begins to decrease that prostate problems begin to increase. So,
That's a great point. That's a great point.
so
I never really taken that into account, but that's a great point.
yeah, well, this is the issue I have with people blaming testosterone for or saying, no, I'm not going to have testosterone replacement therapy, basing a decision on that claim because you need at least understanding the aging of the male and the problems that come with it. I think it's important to take such observations into account. I think um, although some people out there claim that testosterone may have a negative effect on the prostate, and as we know, it's never truly been proven. I always tell them, hang on, testosterone is going down. So, and testosterone going down is not a good thing for the male body. So, I think, yeah, that's a very important point to bring
It's a
up.
great point. It's a great point. Yeah.
Um, okay, so we've talked about the potential negative side effects of, especially of the older methodologies of bolus treatments, single injections, super physiological doses over that are used to cover several months. But what is the methodology that you offer? Can you explain
Yeah.
to the audience?
Yeah, sure. So let me summarize it first. We have, I mean, basically we have several active agents. What you have just mentioned with this very long acting testosterone molecule, that's the testosterone undecanoate,
Mhm.
Nebido, or the brand name is Nebido. What we almost exclusively what we prescribe, that's testosterone enanthate. That is a way shorter half-life, around 4 days.
Yeah.
That means that after four, I mean, you inject a certain amount, let's say whatever, like 30 milligrams, and then after 4 days, you're gonna have 15 milligrams circulating in your body, right? So it's a way lower half-life. Um, what we what we tend to prescribe and which frequency, that has become our gold standard. That is an every other day subcutaneous injection regimen.
And can
Every other day. Very small, teeny tiny amounts in the subcutaneous tissue. Subcutaneous tissue, that means that just right underneath the skin.
yeah.
The huge benefit is that you can do it yourself. You don't have to go to the doctor's office. There are way less side effects. And our patients, they tend to be very happy because, I mean, they can take it into their own hands, right?
Yeah, exactly. For those out there, um, can you understand, can you explain why the side effects are lower in what is called now microdosing, either taking very small amounts, as you said, of testosterone and injecting yourself every day or every second day? Can you explain why microdosing has such a is so much more beneficial than the older method of the past?
Yeah, I mean, so much more beneficial because I mean, our patients, they tend to feel just way better in general. And as for side effects, I mean, you basically you avoid the super physiological levels.
Yeah.
So,
Yeah.
you
So
know,
it mimics our almost mimics our normal male production.
yeah, give or take almost. I mean, we are not going to be able, as a testosterone and testosterone production, it tends to have a so-called pulsative rhythm. It's the highest in the morning. By the way, it's very important. That's why before you jump on TRT, or even you want to have some evaluation, how your testosterone levels, what they look like and how they are, you should always get a blood analysis early in the morning. It's very important. Please do not go in the afternoon. Your testosterone levels are going to way lower than they are. So always in the morning and please on an empty stomach. Okay, you may drink water, but please don't eat because even if you have a breakfast, then that's going to lower your testosterone. So empty stomach and around 8 a.m. That's what we tend to recommend. Okay.
Yeah, that's what I've always done for
Great,
with
great,
my sample, which we'll
great.
talk about soon. So just on the amounts now, um, you've mentioned that with microdosing, your clinic specifically offers about 30 to 40 milligrams of testosterone. That might seem a lot to people, especially
Mhm.
because it's, in the tens. But can you actually talk about how much volume that is for a person to inject?
Sure. I mean, I wish I had a syringe here. So we use these syringes which contain 1 milliliter. They are, I mean, pretty long syringes, but like very, very thin. And that equals to around, I mean, it depends on the individual, right? But we tend to start with around 0.12, 0.13 milliliters
Mhm.
every other day. That equals to, I mean, let's do some math. So in one vial, we have 250 milligrams. That's 1 milliliter. If we are prescribing 0.12, then we're going to be having 30 milligrams, right? Every other day.
Yeah. And for people to really have a visual of that, he just mentioned, so the doctor just mentioned 0.112 to 1.13, right? That's a very tiny amount. That's like half a drop. When we learn in science in school, when I went to university, we learned that 200 microliters or zero point 0.2 mils is one
Hmm.
water, right? Or one drop.
Yeah.
So we're talking
Yeah.
half a drop.
Yeah.
Not much, right?
That's why I mean we have to be we have to be very exact
Mm.
how much we dose because even like the tiniest deviations from the
Yeah,
protocol, they can cause massive deviations in your testosterone levels.
absolutely. Absolutely. This is all very important, I think, for people to grasp because a lot of people talk about the benefits of testosterone therapy, but there's never really much discussion as to the different forms of it. And I think what we're doing here is informing people of the
Hmm.
more modern methods that are available, because I think overall, the goal here is to inform people about, especially males, about how to truly better their health, right? And I think there's a lot of misconceptions behind TRT, um, which we've already dispelled some of these myths. But yeah, I mean, so far it's been great. And now I just want to talk about the worst case scenario, even with microdosing. What would be the worst case scenario, side effects wise, with microdosing?
Great question. So far, I mean, we had around 1 or 2 patients where we needed to discontinue the therapy due to allergic reactions. So we have just discussed how much we tend to administer or at least start with.
Hmm.
A healthy male should produce around 10 milligrams of testosterone every day. That means around 70 milligrams. Then why are we going over this dosage? We're going over this dosage because, I mean, with our 120, around 120-ish a week. Why? Because 30% of the testosterone of the enanthate that contains the carrier oil, that is castor oil, I suppose. So that's why we are striving for this dosage. And like I said, we have had around 1 or 2 patients where we need to discontinue the therapy.
Okay.
Other really bad side effects we have not seen any. What we tend to see, what is even more, I mean, just as important, those are the consequences of the TRT because we are administering exogenous testosterone, so from the outside into the body, and that is going to have certainly consequences.
Hmm. Um, so have you ever seen increased red blood cell production with microdosing at all?
Yes. Yeah,
Okay.
sure. So around, I would estimate around 5% of the
Okay.
patients, they tend to show elevated red blood cell levels, but I mean, that's very easy to manage.
Yeah. How
That's
would
very
you
easy to
manage
manage. So
that?
we have,
How would you
yes.
manage?
yes, we have never. What I wanted, just, let me chime in just
All
one
right.
more time. So we have never really had a thrombosis, which could be led back to TRT. And how do we manage it? Donating blood, Red Cross, and donating some blood. By
So
donating some blood, yes.
I think you just made a great distinction there because um, you have polycythemia, so increased red blood cell development in both cases, but the extent of it appears to be way, way lower with microdosing, both the incidence and the severity. Is that correct?
That's correct. That's correct. So the incidence, like I said, are one in 20 patients around, give or take. And I mean, we have never really had some very serious cases where it went above like 200 or so.
Mm.
There are two units. I mean, you're either gonna see, okay, up to around 18. That's, let me think, that's uh I'm gonna have to look at it. So basically, it's either liters or deciliters.
Mhm.
So that's the main point. We have never really seen where a single case where the patient's red blood cell count went more than 10% above the upper reference range.
That's really good. How would you compare that to the results of Nivedo, which is the previous method of, or still a method today, but what is the incidence
Hmm.
there of polycythemia and the severity? Is it?
Yeah, I can't really compare. We are not really treating
Ah,
patients
you're
with
not doing that
Nebido any
method.
longer. Yes, yes. So that therefore I can't really
Okay.
compare.
No,
But
that's fine.
anecdotally, it should be higher. It should be
Exactly.
higher. But like I said, please take it with a grain of salt, okay?
Yeah, no problem, no problem. Okay, I mean, you've really covered a lot of the questions I think that a lot of people may have out there, even myself, right? Um, and I guess now it's time to assess my own results. So
Yeah, sure.
I'll just share the screen, and of course, I'm going to ask you for an assessment of my own. Whoops, what happened there? Okay, so I was recently measured. Um, Here's my testosterone levels with the reference range, and mine's, at, yeah, 15.9.
Yeah.
I believe you have my SHBG results there.
Yeah, we have already seen that that's in the other PDF that you sent me. That was around 30-ish.
Yeah, exactly.
Yeah, 30-ish.
Yeah.
So just some quick explanation for your listeners. Um, I mean, we as TRT specialists, we tend to look at testosterone total, testosterone free. There are basically two measurements for testosterone free. One is the calculated one, and the other one that's a direct measurement. And in your case, that is a calculated one,
Yeah, that's true.
which is way more accurate than the direct measurement. Please do not opt for the direct measurement. It's going to take an eternity till you get the results, and it's going to be very, very inaccurate
Okay, I didn't know that.
because that's in picomoles. Picomoles. So testosterone free in your case, that was calculated,
Mhm. Okay.
which is good. So yes, SHBG and testosterone. So total testosterone 16. What is your take? What do you think about this level?
Well, I know that optimal should be closer to the 20 range or even higher, more like 22, 23. Um, and of course, brilliant would be 25 to 26. But, as I said, like when I saw this value, I was actually surprised because that meant that on the other scale, I'm closer to the 450 range, which is what most people
Hmm.
kind of associate. They go 300 to about 1,000 as the range, right? And on that scale, I'd be around 400 to 450, something like that. And
Yeah,
again, in that scale, optimal is 5 to 600 at least, right? So I know I'm suboptimal.
yeah.
Just a couple of years ago, it crashed down to 11, and I remember I was in had insomnia back then. Um, I was under a lot of stress. My stress is a little bit better right now. My sleeping is a little bit better, but although those things have improved, there's so many other things that are now creeping up. As I mentioned, I'm more prone to accidents. I'm not focusing. I'm not concentrating. My
Mm,
recovery is terrible. I feel exhausted all the time. And yeah, I mean, does that mean that I need to get to such a low level until I finally get the treatment or not?
yeah,
I don't want to go there either. So, and this is where my own, I guess, decision process needs to be guided and helped because I'm kind of in an internal battle. What should I do? Like I have this internal
yeah,
not battle, but discussion. Um, I know as again with my medical background that this is already suboptimal. I've had really low testosterone just a couple of years ago, and it's going like this all the time. At what point do I need to say enough is enough? It's time for me to, you know, take action. And so for me, it was still, when especially when I sprained my ankle 2 months ago, and I was just jogging normally, and suddenly I didn't concentrate again. And this is the second time I sprained my ankle, and this time the recovery was way worse. I'm still hobbling along,
mm,
and I'm just realizing that I'm not who I used to be. So that's why I wanted your expert opinion on what you mentioned
yeah,
on looking at the matrix. So over
yeah.
to you.
Yeah, it's for sure that's the decision matrix. That's why we are there for you to navigate in this whole. I mean, that's a huge decision, right? It's
Yeah,
a huge decision. Should you jump on TRT? And then we have to emphasize also for your listeners that, I mean, that's a lifelong decision. We are not recommending something that you could just take for a couple months and then set it and forget it, because that's really a decision that's gonna accompany you probably until the end of your life.
exactly.
So let's look at these levels. I mean, as you said, I mean, you evaluated that very objectively. Levels around 16, coupled with this SHBG of around 30. I mean, they are not terrible levels, but they are improvable. What you mentioned before, you also had levels around 11. I mean, those are the levels where we firmly tend to recommend a TRT, because we know that the probability of the risk and benefit ratio is going to be so much more skewed towards the benefit than towards the risks. So yeah, should you not? I mean, I've only seen this one measurement, but if you're telling me that your measurements before that they used to be even lower, also taking into account even more important than the levels, how you have felt lately. I mean, you said that okay, you have felt a gradual decline in certain aspects of your life. On top of that, also in this whole decision matrix, is there a wish for childbearing? And now I'm jumping back to this whole topic of consequences. They are not the side effects of the TRT, rather the consequences. So, like I said, clinical symptoms, which are these three pillars that I have mentioned, then the clinical levels, and then also your I mean family situation, what your goals are, your age. Should we not?
Yeah.
And I'm saying, okay, now you have kind of, very in a detailed fashion, you told me about your background. I mean, if I were you, I would try at least.
Mm.
I would try at least. And there's a high probability that there would be a way bigger benefit than the risk,
Mhm.
than the other side for risks. And just, that you would say, okay, 4 weeks have passed. I should have already felt a huge difference in my general well-being, and nothing really happened.
Okay.
So at these levels, I think it's highly likely that the benefit would be way bigger than the risk.
Yeah, I mean, and just for context for people, of course, I'm a father. I have two children now in their teens, and I have no wish of having further children. I would have wanted to many years ago. The circumstances were not right, but at this age, it's too late for my wife and I to have more children. So that, of course, is a very important part of this decision.
Yeah, absolutely.
It affects family planning, and I think it's very
Yeah,
important for people to take that into account. This is a lifelong decision. Um, but again, I'm reaching my 50s. There's no way I'm going to get more optimal testosterone. It doesn't matter how many
probably not.
test boosters I do and this and that. I eat pretty clean. I train often as I can. And yeah, I think it's a decision that now I'm going to have to make given all the information you've given me, doctor. But
Yeah,
the fact that I can try it out for a month is really also inviting and enticing because I know that should I not gain any benefit, then I didn't lose anything, right? And I tried at least
yeah,
to improve my health. But if I see a great benefit, a sudden, that it's a night and day improvement, then I've only got the benefits to gain and my life to regain in that respect. At least those things that I'm losing, and I think as I said, it's a very important decision for me now. So yeah.
yeah. Perhaps two things to mention to wrap it up. Um, let's skew this whole decision matrix into different direction. Let's suppose you are, I mean, not you, we have a patient, he's 25 years of age, severely overweight, has never been to the gym, has the same testosterone results, and I mean, is planning on having children in the near future, at least three. Would we recommend TRT?
No.
No, because we would say, okay, optimize your lifestyle. That's point number one.
Exactly.
Point number two, yes, I mean, you can always try it. I mean, someone can always try it and see, okay, is it of benefit? Was there a huge benefit or not? That's not what we are striving for. So when we are again navigating in this decision matrix, we really try to make an informed decision and tell patients, okay, with a high probability you are going to be benefiting from it. You can always discontinue the therapy. That's always possible, but we are really trying to make a decision. It's nevertheless, I mean, it's a drug.
Hmm.
It's an exogenous drug that we only prescribe if we firmly believe that that benefit is going to be way bigger than the risk.
Yeah. And I think it's important that you mention all of that.
Yeah.
Um, and again, well, I didn't even know. I was gonna actually say something and now I kind of forgot. Um, but anyway, um, Doctor, I just want to thank you for your time, for your effort in really clarifying my situation, but not just that. I think our conversation today is very important for men to hear, especially men around my age who are going through the same things. And I want to thank you for your honesty because it's easy for a doctor to say, just take the drug, and I get a prescription from my patient and great, and I keep getting more patients, right?
Yeah.
It's I think it's very hard actually it's not hard, but it's not often that you get, first of all, a doctor to speak to you like this so openly about the pros and cons of their own services that they provide, right? But you do it openly, you do it honestly, and the way you do it will help educate people to make the correct decision because it is, as we mentioned, a very important decision that affects the rest of their lives. So I want to thank you for your openness and honesty.
Always welcome. You're always welcome. All right.
But
And to listeners, thank you for listening and
yes,
take care.
thank you
Take
very
care.
much, Doctor.
Bye bye.
Okay, everybody. So as you just saw, I was just diagnosed. This actually happened earlier this month of August, 10 days ago to be exact. Today's the 31st. And I just want to really speak about all of this very openly. As many of you know, I'm very honest. I don't fart around. I'm very blunt, but I try and be as transparent as possible. I'm actually going to show you all my results. As I told the doctor, I've been investigating my own hormonal health. As many of you probably know, I'm going to be 47 this year, right? So, yeah, I've been noticing several things like clumsiness, as I mentioned, right? And you can see my results here now for testosterone. Over the years, as you can see, actually, yeah, back in 2020, on the 10th of September, I had a result that was as low as 320, right? That was 11.17 nanomoles per liter, which is the equivalent of 320. That is pretty much below normal standard. And that is when I actually saw this doctor here. She asked for a repeat sample. As you can see, it went slightly above normal, and that for her that was enough, right, to say no TRT for you, although she did say there was a bolus injection, as I mentioned earlier. And it's also been as high in 2022 as 620, but that was a very bizarre result. It could have been a one-off, but overall you can see my results that I've graphed here. They kind of hover around the low 300s to, you know, up about 4, even at times 500, right? But most of all, the average, the overall average, is about 440, right? That's my overall set point. It's 440. That's suboptimal, which is what is now more or less what you would call my set point in testosterone production, right? This means that my overall test level at my age will likely not get any higher with time, but actually continue to decrease over time as I age, right? So my decision is to, you know, after all the assessment that's been done, all the consideration, please understand this process has been going on since 2020. So we're talking 6 years, right? And yeah, my decision is to try out TRT. And at first I will try out a boosting protocol of HCG and Clomid that boosts one's natural production. Why? Because I would rather try and boost my own natural production than to completely shut down my own production, right? I never like having things removed from my body or just completely canceling their function. I always try and do things towards the more natural side, right? Having said that, my doctor has already warned me that it is not a very successful protocol, but I can try it, and I'm going to be actually trying it for a month. That's my decision. I'm going to try it for a month, then be reassessed by my doctor again in late September. As I said, right now it's the 31st of August. So we're going to reassess late September in 4 weeks in this year 2025. If I do not see or feel the desired benefits, then I would likely have to start taking injectable testosterone using the microdosing protocol, as we already discussed in this video. Now I would like to once again thank Dr. Cheeky Strauss for his expert assessment of my hormonal health, and it is something I highly recommend for all men who are in their middle ages, like myself, especially if you are seeing a decline in your health, be it mental or physical. And I can tell you that I've been seeing these changes for many years. They're not drastic changes, but they're little changes that start adding up. Many of you that have been following this channel are aware of the health little battles that I've had and faced over the last few years. Little injuries here, little things there, right? And my hope is that with TRT, that it will help me with my overall mental and physical health and vitality. If you live in Switzerland or in Europe, Dr. Cheeky Strauss is available at trtdoc.ch. So trtdoc.ch. And you can book a call by visiting his website. If you have enjoyed this video, then please give the video a like, subscribe, and leave me your comments. And I've got some questions for you guys. Are you guys on TRT? If so, please share your thoughts and comments. I will update you all on my own TRT journey and see whether I see any benefit or not. That's it from me. This is the Golden Era Bookworm saying bye for now. Head to www.goldenerabookworm.com for the biggest range of classic old school bodybuilding books as ebooks, e-magazines such as Iron Man and Reg Park Journal, high quality bodybuilding posters of the Golden Era stars, merchandise and classic gymwear featuring Steve Reeves, Marvin Eder,
John Grimmick, Reg Park, and many other Golden Era stars. For those wishing to build a classic physique, lose fat, and build muscle, online training is also available. Collectibles such as rare autographed photos from the Golden Era stars are also available, and to collaborate, please get in touch. Now, if you're interested in learning more about Vince Gironda's approach to bodybuilding, his principles, and all these tips of wisdom that he has, I mean, there's so much stuff that probably hasn't been proven by science, and it will take science to prove or disprove Vince. But to be honest, these 3 books, I believe, which I call the Classic Physique Bundle, are the best books that Vince ever came out with. And they, of course, are the Wild Physique, the Master Series, and the Pro Series. Have a look at it this way. The Wild Physique, I believe, is like the ABCs of Vince Gironda's principles to bodybuilding. He teaches you the exercises and his principles. But how do you put them together? Well, the Master Series is a 14-month program of using all of these principles, all of the diets that Vince came out with, all of the exercises. And of course, the Pro Series was a book that he came out with later on, specially targeted for getting into competition. It's just these 3 books, as I call it, the Classic Physique Bundle, Vince's best work, and available, of course, at www.goldenerabookworm.com.